Mental health in older adults during the COVID-19 pandemic. My team is Luz, Sofia, and Diana. The general population is at risk for COVID-19 however. Infection in the elderly confers a high probability. From the age of 60 years, cases of severe disease, mild cases. The pandemic has generally changed to complete with strict social isolation older adults vulnerable. COVID-19, which has represented a risk for the development of stress, anxiety, depression, violence, and mental health disorders.
Research of Psychology. The Anahuac Center for Research in Psychology conducted a longitudinal study to understand the psychological responses, concerns about COVID-19 stress, anxiety, depression, and sleep disturbances to the pandemic in older adults in 19 regions of the state of Mexico and at 3 different points in time. Results were most of the adults suffered from risk diseases. As time went on, there was greater awareness and concern about the risks posed by the pandemic. It was found that both anxiety and depression symptomatology increased with age measured. The Mexican government makes some recommendations. For example, help them stay connected, feel involved and useful. Consult reliable sources of information to avoid falling for fake news and panic. Maintain a health diet and encourage them to be physically active. Make sure they have their prescribed medication and the material they need to take care of their health.
The pandemic can exacerbate anxious or depressive symptoms already present in older adults by increasing the burden of mental stress due to the possibility of becoming infected with COVID-19. It can increase stress in older adults because they are a population at risk and thus increase their feeling of fragility. The social isolation necessary for quarantine can decrease or interfere with the social support networks that many other adults have and can increase the feeling of loneliness in them. It can increase the threat of losing significant relationships with other older adults due to the possible increase in mortality in the risk group. See a psychologist or psychiatrist if you notice any symptoms of deteriorating mental health in an older adult. Brief insulation, decreased physical activity, irritability, less communication, and loss of appetite, among others, are symptoms of mental illness. As long as it is allowed in your place of residence, take them a meal, walk their pets, carry out shopping errands that they can carry out. Find a way for older adults to return to routines they had before the pandemic so they can regain a sense of stability. Have activities with them in which they can reach a goal or an enjoyable achievement, which can be individual or group tasks.